Very good morning everyone here. So I am Nihal C. Abraham from BBA second year. A respected HOD, School of Nautical Science, Captain Sujit Kumar Patak sir. Our guest and speaker of the day, Dr. Rahul Krishnagurti sir. AR madam, Srija ma'am and faculty and all our staffs here, and of course our lady students. We are gathered here to observe the SWASTH NARI Sashakth Parivar Abhiyaan, which is a nationwide Indian health initiative to improve women's health and nutrition, a crucial factor for stronger families and healthier nation. As we are aware, women's health and empowerment are key to advancing families, communities and the nation, and aligning with the vision of Vikasit Bharat at 2047, the Ministry of Health and Family Welfare launched the SWASTH NARI Sashakth Parivar Abhiyaan from 17 September to 2nd October 2025, ending on Gandhi Jayanti. This campaign will run alongside Poshan Ma by the Ministry of Women and Health, Child Development, and was nationally inaugurated by the Honorable Prime Minister Srimad Narendra Modi in Indore, Madhya Pradesh. This Abhiyaan deployed more than 1 lakh health campus over Ayushman Arogya Mandirs and community health centers. It intends to ensure comprehensive screening for women's health issues like anemia, hypertension, diabetics, and cancer. One of the key objectives of Abhiyaan is to support immunization efforts and nutritional benefits to reduce maternal and child mortality rates. The Abhiyaan aims to operate on real-time monitoring through the Sashakth portal to ensure transparency and efficiency. The SWASTH NARI Abhiyaan Parivar Abhiyaan has community support system as one of its pivotal components, with Niksha Mitras being critical to the implementation of the scheme across the country. So yes, as the slogan says, every empowered family begins with the healthy women. So to talk more about this Abhiyaan and about women health and hygiene, we have Dr. Rahul Krishnagurti with us, who is also the consulting doctor in our university. We have every alternative days. So with great pleasure, I welcome Dr. Rahul Krishnagurti sir onto the stage to take the session.
So good morning. I'll be dealing today with awareness session, mostly like screening for our breast cancer, oral cancers, and hypertension, diabetes, and just anemia. Most importantly, menstrual hygiene and tips regarding to the same. So I'll start with cancer. So. Early detection, like if we do, it is better for treatment and survival. So many cancers are preventable and curable if it is found and diagnosed early. So it reduces suffering and it can save life. So firstly, when it comes to oral cancer screening, avoid all those things like tobacco and alcohol. You have to maintain your oral hygiene, all those things. Then visual inspection of the mouth, like when you wake up, just see your oral, how it is day to day, and if anything suspicion is there, like you should take 6 months you can take a dental checkup or dental care. So early signs, like when we see, like when you go for a sore throat to a nearby clinic or hospital, doctors can see like there will be some patches, red patches or a white patches, which we see and which we send for some screening, and we can diagnose that as such. So whatever you feel like, when you have something which you found unusual, just go to the nearby clinic or hospital and show to the concerned doctors or medical professionals which is available nearby. So breast cancer screening. So what we do is we screen for all the women around 40 to 74 years, those who have family history, something like that. So the most thing which we come is self breast examination. So it can be done from age of 20 years. So the examination is firstly, what we have to do is we have to note the changes, if anything we have seen. By first we have to observe ourselves, like we see either dimpling, like you have the nipple area, so if the nipple is retracted or something which you found unusual, you can see it in the mirror and like that. So you can do it once in a month. So it is better you do it after your menstruation. That's after the cycle. If you do, it will be more good, because during the menstruation already it will be little tender and it will more stiffer. So you can do is you can stand in front of a mirror and with your shoulders straight, arms at sides, look for the skin changes. If any dimpling, orange peel appearance, we call it pudgy orange in clinically. So all those things and any dots, something like that, and feel for the lump. That is more important. Lump actually how we examine is different, and self-examination is we have some we feel for any lumps. That you can do is you can use the pad of your fingers, 3 fingers, not the tip, your pad, this part, and you can do circular motions with light, medium and deep pressures. So what we have to do is we can vertically feel and horizontally we can feel for any lump which you have it with both your hands, and you can see if any lump, anything like a swelling which you can see in your breast area. And after that, don't forget about the nipple. So just gently, like if you have any pain, something, you just squeeze and see for any discharge or anything. Then in the armpit you can see for lump. Same, you just change your hands in this position and you can see for your armpits, so that any lymph nodes, anything is there. Same with the lumps. And you can, like if you know, you can just see for any nodes. This is called the supraclavicular bone. So you can see if any nodes, anything is there here. Just palpate. If you can move your neck this side, and you can just touch and see. If you touch and see there, you can see some small nodes. You don't see it now. You can see some nodes here. Along with that, in the axilla also you can see. Then you have to meet one nearby doctor. Then you can also place your hands on your hips. Then frequently with a tighten the chest muscle and look for any skin retractions or any abnormal patterns or changes in your skin. So this is about self-examination. So clinical breast examination, it is every 1 to 3 years. So yearly after 40 years. So what we do is, if any patient comes with lump, we ask them for a mammography and ultrasound, we confirm it, and we do the FNAC or the guided procedures, and we post them for any surgical techniques and chemotherapy after. So what we have to pressurize is the self breast examination and the care which we give to ourselves. So we have to examine one, like especially if we have any family history, anything significant, we have to do the same. Next is cervical cancer. Mostly it is around women of 30 to 65 years of age. So what we can do is we can see for any abnormal bleeding, pain, and pain while intercourse or bleeding while intercourse. All this points to, but not everything points to cancer, but we have to rule that out. If we are obese, like if we have any family history of any other cancers as well. So what we do is we do a pap smear. We take the swab from the mucosa and we send it, and we can get the presence of the HPV. But why we can't get it in the blood is because it usually lies in the mucosa, not in the blood. So no blood tests are available for the same. Then what we have to be vigilant about is abnormal bleeding, foul smelly discharge which we get from the vagina and all. We have to see and immediately contact a medical health professional. So what screening does is, screening can save life, and breast same thing. Cervical you can do this same examination. Then encourage it. Whatever we have the knowledge with us, share it with everyone, so that they will get, like someone of your cousins, everyone, you will be facing some symptoms, like they will be sharing with the colleagues mostly, not with the concerned authorities. So just guide them properly as well about the screening techniques and the available treatment options. And nowadays what we see is before and all, what we do is we track the genetic pathway. Like if someone is having cancer, their family, someone will be having, second cousin, relatives, all that we can trace. But nowadays it is not like that. Cancer is just like something which we come day across. When we trace the family chart also, nothing will be there. So what we have to crucially look is our health. First of all, a lot of pollution, everything is there. The food we get, it is fully adulterated. Now nutrition, something we call like nutrition experts, YouTubers, Instagrammers, lot of people are there, so they are not that qualified. So they'll, what they tell is sugar cut is actually good, but sugar, instead of that, if we go for a, go out to a cafe or anything, and if we tell one tea without sugar, but along with that if we tell one cutlet, samosa, like that fried items, it is more dangerous than sugar, because what oil they use we don't know. So they'll be using sunflower oil, canola oil, all those seed oils, and don't know whatever oil they are using. So it will cause inflammation in our body. That inflammation triggers responses in the form of cancers, allergies, all those things. So visibly see what is good, see what is good for you, and consume those. So like in most of our homes we may be using sunflower oils. So sunflower oil is we get it 1 liter for around 220 or 180, I think, roughly. So sunflower seeds, if we buy, it is 150 or 200 for 100 grams of sunflower seeds. So we will be requiring around 1 kilo to get at least 1 liter, at least 500 ml. So you can see the price, and what they give is fully adulterated. Same goes with the fruits. Fruits, like they use artificially lot of things they use to ripen it. So all those things we have to, but that is not we till government should take lot of steps, but it's like that. But better we use that kind of fruits, like watermelon we have to check and see, but other things like this thing is there, no, guava, avocado, that is little more anar, safer side fruits which we can have. So all these, the nutrition is the most key. Just as I said, the family history of cancer has, because before and all, what we have been seen that our ancestors, they are mostly healthy in the sense they don't consume fast foods, junks, all those things. So they'll be consuming rice, wheat, all those things. So they were okay, but they'll be working in the field, paddy field, all those things, so they are more healthy. But nowadays what we do is we work, like females are working, that's good. So female, what happens versus, we'll be going to work in the morning, afternoon, evening, so food preparation might be a problem. So what we do is we'll binge eat, we'll take pups, something like that and all, so it will be damaging our health. So that leads to lot of things, like if we have any food from out which is not that which is contaminated, it can give rise to that worms, so it can cause anemia as well. So food nutrition plays a most important role. Nowadays nutritionists are also telling like we have to have a morning, afternoon, 8 o'clock one meal, 11 o'clock one meal, 1 o'clock one meal, 3 o'clock one meal, 6 o'clock one meal. So that what it does is it triggers insulin, but that is not the way. But each nutritionist, they have their own. We have weight loss pattern, we have weight gain pattern, we have crash diet, we have lot of diet. Like each individual has a separate entity. In Ayurveda we tell we have Vada, Kapha, Dosha, Pitta. So they treat accordingly the patient with the like see in their body. What we do is we have one medicine, we have give it to all. So if we give antibiotics as well, like if we see here, for example, 10 students will come or 10 patients will come. So what we do is we start with the basic antibiotic if required. So moxicillin will be the basic antibiotic. So if we give to 5 patients, they need faster recovery, and what they tell is either the medicines will be same for all. But we are bent to do that, because if we give, we know like lot of antibiotics are there, but the basic thing what we have to give, we have to give. So antibiotic resistance is also one factor nowadays. So wise use of antibiotics, like when we travel abroad mostly, or when we travel to other places, you might be coming from some other places to here, so you will be carrying some antibiotics with their prescription. So what we do is they will be telling, take this antibiotic for this, for that, but just the symptom starts, we take the antibiotic. So that and all, just always see a medical doctor and move forward. And nowadays health we should first of all, stress is there a lot. The stress is impacting not only in every field, stress is there. In our field, stress is there, students field, working field, everybody. So stress has to be managed as well. Stress will be as equivalent and as bad diet, because stress causes increase in cortisol. Cortisol is a stress hormone. So this stress hormone can trigger various problems, including autoimmune conditions, everything. So this is mainly about breast cancer and cervical screening. Next, hypertension and diabetes awareness and screening. Hypertension and diabetes, as you know, they are silent diseases. Like once when we start putting weight, gaining weight, when we have any symptoms, we tend to visit a doctor. Mainly what happens is when we have fever, when we have any problem, we used to tend to visit a doctor. So that time when we check, the BP will be anyways high, because our body is in a place of stress. So what they'll tell is your BP is high, come regular follow up. So what we tend to do is, when the fever subsides or when our present condition subsides, we won't go for a follow up. So that might be hypertension, or that might be due to the fever, but we have to go check for that. First of all, if our health is bad, if our parents or ancestors is having BP, we have a family history, then we have to check your BP and sugar. Same as cancer, early detection is longer, healthier life. So diabetes, as a nutshell, what we can tell is when your fasting is above 100, that is just a range 100 to 110, and ppbs is around 160 to 170, and HbA1c is about 6.5 and higher. But it's good when you check it. If you have a strong family history, it's good when you check it in 6 months, and if your health is bad, you can check it around 6 months. And diabetes anyways, it can cause heart disease, kidney problems, blindness, amputations. Risk increases with unhealthy diet, inactivity, obesity, and family history. Only a blood test can confirm you have sugar, but you have some symptoms, like you will have dryness of the mouth, you have palpitation, sweating, lot of things are there. Like other conditions are there as well. Like if you have a meal, after that 1 hour you might get sweating and palpitation, but it doesn't imply that you have diabetes. It can be another condition such as insulinoma. Each symptoms are not specific to one symptom. Like if we say bleeding for cervical cancer, doesn't mean that every bleeding is for cervical cancer. So I am not going into more symptoms that which will make you worry, because if I tell any symptoms, most of the students will be having some more one. So hypertension, as you know, it can damage your heart, brain, kidneys. Usually it has no symptoms. Check your BP at least once a year. What else we can do is, like nowadays in high altitudes, what happened is their iodine deficiency was there. So after that, it was roughly whole India, it was told like consume salt with iodine. So what we in Kerala and other Karnataka states and all, we already used to get iodine from our diet, like non-veg, everything we get. Only in high altitude area that problem is there. So normally if anyone who consumes our iodized salt, they'll be having BP after 40 or 45 years. So it is better we change the option. Like iodized salt is not required for everyone. You can go for either Himalayan pink salt, Celtic sea salt. Options are there. So switch to that type of salts. And that is one regarding this thing, salt. And what we have is, if you are obese, your arteries may get thickened and all, and hypertension can cause like that. And some other causes not relating to diet is renal artery stenosis and something like that, which is more of clinical side. You will be one day you will be having one BP, next day you will be having another BP. So variation will be there. But some doctors start off medicines, like nowadays functional medicine, a new aspect has come, because what they do is familial hypertriglyceridemia, like that, familial hypercholesteremia, same thing, and hypertension. So what it is, MTHFR gene mutation is mainly related to that one gene. Genetic testing, same thing it is. So all these people will be having one gene mutation. So this gene mutation will be absent in that patient, and the normal conversion doesn't happen. So TMG levels will be high, and if you supply them with one multivitamin, so they'll be folate, we tell it folate, so they'll be free of BP. Studies are going on, but whenever we see a patient with BP, we initially what we do in a clinical practices, we'll start, because we have studied like that, like BP is dangerous according to American Heart Association, this is that, this is that, this is that. So even the treating doctor should also have a this to what differentiate all those things. Who should get screened? Everyone 35 years and older, adults with obesity or family history, pregnant woman, all adults for blood pressure starting at 18 years of age. How is screening done is hypertension, simply checking with a machine. Machine is not recommended that much, because if you are taking BP on a machine, it will show variation. So it is better if you are doing it with a automatic this thing, BP apparatus. Check 3 readings and take the mean, or else check it in conventional way. So diabetes, same thing, HbA1c, FPS, ppbs, you will get an idea. HbA1c you can check in 6 months. HbA1c usually gives the blood sugar of around 3 months, because the span of RBC is around 3 months, so 3 months sugar will be isolated from that. So get screened even if you feel healthy. Screening just takes a 10 minutes or maximum half an hour, but it can save a lot of your forward time. But nowadays when we run through our stress, like now, but today if we take, will be lot of, according to me this class is little more big. In between, if I have some health issues, this class is nothing, that health issue will be more for me. If I have vomiting because of stress, anything, that vomiting or something which is happening will be more concerning to me. So at the end of the day, whatever we do, whatever we work, everything, our health is more important, so we should give utmost care for that. So early detection prevents stroke, heart attack, kidney failure, blindness, all those things, and regular checkups can also save lives. So next is the most important thing, anemia. So anemia awareness. Anemia is common among adults and girls and women, leading to fatigue, poor concentration, reduced productivity. So anemia mainly it can present with most importantly low BP and palpitation. When you climb your steps, you will get more palpitation, you will feel more tired, and if you even have a meal or juice something, still you will be like more dizzy, you will be more sleepy, all those things. So in your age group, mostly it is because either fast food and all those things, and first of all, I don't know how many of you are coming from home, and that homely food will be missing, and like when we are at home, it will be a complete balanced diet. We will get everything, fruits. I think here also we provide with fruits and all, and but in between which you binge outside from eating, like snacks and all, plays a crucial role as well. Like when you go have food from outside, like we don't know how they prepare it, how much time it has kept there, whether flies has come, how they handle the guy who's preparing, whether he's wearing any gloves or not, hats, all are important. Now actually when we see hoteliers nowadays, those who don't have a business, they start this. So with that money they'll start this, and they have to reach one target. So cleanliness is least important. Quality of the things they compromise very badly. So that is the main reason which we get for this illness and all. So early detection and counseling about this, and increasing health increases risk during pregnancy, maternal and child health issues if you have anemia. So now according to this, you will be having, like some people, some adults and females will be having over menstruation bleeding. So normally it is 2 to 3 pads, or it will be more soggy. So that time you have to see what is the cause. Initially in adolescent age, the bleeding will be more for quite a period of time. Along with that, pain will be there. Most of you will be experiencing that. So that pain mostly is because of the constriction of the muscles. You have the uterus, you have the ovary, everything. So these menstruation creates a lot of hormones. These hormones, already blood is being pushed out. So it vasoconstricts, and the bladder this thing, the uterus muscle becomes more constricted and we get that colicky pain. So that is actually a normal phenomenon, but some people pathology is there as well. So that is what it causes more pain. So that time what you can, mood swings will be there, pain will be there, and if anything is there more significantly, like if you ask your colleague or someone, they might not be having any pain that much as comparing to yourself. So just see an ultrasound, just see how your diet is, and just see if it is regularizes after 2 or 3 cycles. And you can check your HB level, that is more important. You can check a CBC and out of that you can find your HB, how it is. Normally what we require is around 12 to 13, and for females it is 15, 14 to 15, and for males it is 12 to 13. Anemia is also of two types, like iron deficiency anemia and B12 deficiency anemia. We call it macrocytic anemia and megaloblastic anemia. That is the clinical side. And B12 deficiency, nowadays vitamin D3 and B12 deficiency is also come into a play. So D3, no one is going out getting the sunshine, nothing is there. So, and along with that B12 also plays a role. So B12, what you have to do is, those who are vegetarians can increase their like just Google it, which foods are rich in vegetable foods which are rich in B12, and non-vegetarians can get it from meats and all the organ meats, chicken, liver, all those things. The nutritional advice what we can give is eat iron-rich foods, which are green leafy vegetables, beans, meat, and eggs. Egg is actually good. Like egg is, like we have a stigma. Egg is when we have it, we'll get lot of cholesterol and lipid profile will be high. Actually, egg yolk contains one lysine. That is one amino acid which is found only in the yolk of the egg. So that is highly we have to take. Instead of taking one idli, it is better you consume 2 eggs and wrap your breakfast if you can't have anything. Not egg puffs, simply 1 egg. So you can also include vitamin C rich foods to increase iron absorption. Vitamin C is actually better for iron absorption. When you have anemia, if someone is having anemia, what we do is we'll give tablets for 1 month. So only if you take, and your iron stores iron might get 2 or 3 drops high, but we have to continue it for around 3 to 6 months. Only then the iron stores which have been replenished comes up. So what we do is we just start it for 1 month, we'll drop it, then again after 3 months we check when we get symptoms, then again the HP will be around 8, 9, like that. So iron tablet recommendations, like seeing your whether it is, how we differentiate is we see the MCV and MCHC, and we differentiate it whether it is iron deficiency or B12 deficiency anemia. And what we can do in the lifestyle is a good hygiene and deworming. Deworming, if you are regularly consuming foods, because worms can, ascaris, which we get usually by culture and all from the stool, what it does is it hooks up to the intestinal wall, and it drains all the nutrients as well as your iron. And when we deworm, it is better you deworm adults like weekly once for 4 weeks. So because the adult worm will be lost during this treatment, but the egg will be there. So the egg will hatch, and mostly after 2 weeks. So 4 weeks is the course. And regular health checkups. Don't wait for this thing, any stress or anything which you have. Initially, just like when you donate blood and all, just check for CBC also. Then now what we have to do is promote menstrual hygiene, which we will talk about later. Provide weekly iron and folic acid supplementation. Involve school and community health workers in the awareness. So anemia is preventable and treatable. Screening helps identify at risk girls and women early. Like if you come for tiredness and all, we can see the conjunctiva and we'll tell whether you have anemia or not, because it will be little more pale. That is the examination which everyone can do very easily. Mr. Pallor. So balanced diet and supplements are key to prevention. Supplements you can take is B12, which we get common B complex. It is good actually. So that supplement when you take, some people will get yellowish discoloration of the urine. That is because the absorbed methylcobalamin usually goes through your urine. So plenty of water will dilute it. Counseling. Then counseling empowers adults and girls and women to take change of their health. So I made a list of food to tackle anemia. Folate and B12, vitamin C, okay, heme and red meat, beef, lamb and liver. Red meat, like if it is organically sourced, grass fed, if we get, it is good. And poultry, chicken, turkey, same. Broiler doesn't meet our needs, but it is better than fried or anything. And seafood, oysters, clams and tuna, sardines. Then plant based, if you are vegetarians, you can have spinach, kale and Swiss chard. Swiss chard is cheese. Then legumes, then lentils, chickpeas, all those, kadala, all those things, beans. Then tofu is actually very good. Comparing to paneer, tofu we have a lot of protein as well as this thing which can tackle anemia. Pumpkin seeds and sesame seeds, it's also actually very good. Sesame seeds. Then fortified cereals. Oatmeal we don't recommend that much. Then quinoa is good, that's small rice. Then oranges, lemons, grapefruits. Grapefruit is actually powerhouse of vitamin C. Lemons and oranges. Bell peppers, strawberries, tomato, broccoli, kale, Brussels sprouts. It comes in cruciferous group of vegetables. That's very good. Then leafy greens, spinach, romaine lettuce, avocado, banana. Then vitamin B12 rich foods, like two type of anemia is there, no. So vitamin B12 also you can increase, egg. Then milk, cheese, yogurt, fish, meat, especially liver. Then plant based is mostly that chickpea, beans and all. Then if you are taking iron supplements, preferably don't take it with tea or coffee. It will decrease the absorption of the iron tablets, as well as don't take it with high calcium foods, and don't take it with antacids. You can pair it up with vitamin C, so it increases the absorption. One sample anemia fighting meal is grilled chicken plus sorted spinach with garlic, orange slices. So it comes everything. So that is regarding anemia. So next is menstrual hygiene. Menstrual hygiene, you can choose suitable menstrual products. Like some will be okay with sanitary pads, some will be okay with tampons. Like sanitary pads, it is widely available and easy to use. Tampons, it is discreet, good for sport, swimming, must be changed regularly. Menstrual cups, you can reuse it, eco-friendly and can be worn up to 8 to 12 hours. Then reusable cloth or pads or period underwear, washable options. Choose what it feels most comfortable and practical for you guys. Maintain cleanliness, so change pads or tampons every 4 to 6 hours or sooner if heavy flow is there. Empty and wash menstrual cups every 8 to 12 hours with mild soap or clean water, the tampons. Never wash your private area with any soap or any other substances. Already our vagina has a normal pH, so like products are available, we wash, lot of things are there. The normal pH, we can use it only when any problem is there, like when the pH like for example if water drinking is less, so what happens is our pH changes. In that change, bacteria tends to grow, so that time you can use V wash, which is over the counter, and after that you can stop it. Only that time, that for that pH change we give that. But nowadays everyone is having buying that and using, so that normal pH will get disrupted and every day it's the same. We'll get recurrent infections, we'll get discharges, all those things. So next is personal hygiene. Wash genital area with clean water, avoid harsh soaps or scented washes. Always wipe from front to back to prevent infections. Keep the area dry to reduce irritation and odor. Safe disposal. Next is safe disposal. Wrap used pads or tampons in paper before discharging it or in a bin. Do not flush pads, tampons or cloth into toilets. Never flush it out. Use covered bins if possible to maintain hygiene. Then clothing and comfort. Always wear breathable cotton underwear. Change underwear daily. Carry extra pads or tampons while leaving home during your periods. Then nutrition and self-care. Eat enriched foods, which we have discussed earlier. Leafy greens, fortified cereals, and per day drink around 3 to 4 liters of water. Rest and use heat packs for cramps if needed. Then seek medical help if you experience heavy bleeding, like if it soaks more pads hourly. That time what we do is we'll check for an ultrasound or a TVS scan and look for the pathologies. It could be in your ages, it could be fibroids are less common, but initially that adolescent age can present with little more increase in the volume, but it gradually becomes better after. Then if any foul smelling discharge or anything is there, just consult your nearby doctor. So next is nutrition. Nutrition and wellness, 2 more sessions are there. And TB, one more research. So nutrition plays a vital role across the female lifespan. Adolescents need nutrients for rapid growth and development. Older female requires nutrient-dense food for healthy aging, bone health, and disease prevention. As what we tell is a balanced diet, a mix of carbohydrates, proteins, fat, and small minerals. Protein mainly helps for growth and tissue development. Iron helps for menstruation and blood volume expansion. Calcium and vitamin D helps for bone growth. Just because we study, like when I am telling it's calcium and vitamin D for bone growth. Nowadays what happens is everybody, like just for one bony pain, everyone used to tend to take calcium tablets. So this is made up of calcium carbonate. So this is what we get in India. So this calcium carbonate never gets absorbed. It usually what it does is it sits in your arteries. So it becomes calcification. Calcification makes you age faster. So this calcification can increase your risk for attacks and all those things. So better and leg pain, everything. So calcium carbonate is only needed when it is like osteoporosis conditions which are more severe. So always pair it up with K2M7. Only then the calcium which we have, not the calcium carbonate, the calcium citrate is a better form, and that can go to the bones. Always calcium will be bound with albumin. So in order to, if you take calcium carbonate, if your family someone is taking also, just whenever we go to ortho doctors, they'll for pain what they do is they'll give one calcium carbonate, and we used to take it regularly. So all these what it does is sticks to the arteries, and what it does also, it takes the minerals from our bones as well for the metabolization of this calcium carbonate which we take as a tablet form. So vitamin C rich foods is orange, strawberries, bell peppers, and iron rich greens as we discussed, spinach, kale, broccoli, which prevents anemia. Then potassium rich foods, we have bananas, sweet potatoes. Then it's for your muscle and nerve function. Then carotenoids, that is mainly for your eye, retinol, retinoic acid, all those things. Vitamin A derivatives, it's for your eye and skin health. Mango, carrots, and all you can have. This you can have it around 5 servings per day in adolescents. Okay, instead of using all those bakery items, you can opt for this. Bring one packet of anar something, use it in the snack time, if you are hungry. Then you can increase your fiber for your digestive and cardiac health. Whenever you consume something, like if you buy something from outside also, just see the ingredient list. And even if you get sausage, what we tell is it is usually healthy, it is made up of chicken, it is protein, but it's not. because when you turn the front this thing and see the ingredient list, you can see maltodextrin, soy lecithin, all those things. But these are gut, our gut lining is there, intestine, which has good bacteria. All good bacteria will be disrupted. So omega 3 fatty acids which you should take if you don't consume any fish. It is required for your brain health and heart protection. Omega 3 actually studies are showing it will increase your HDL as well, but you should get a quality omega 3. You have to see the EPA and DHA content as well. Then calcium rich greens is collard greens. Collard greens is broccoli, Brussels sprouts, all those things. We call it Chinese cabbage and all small cabbages. Fiber rich foods is apple, pears, berries, and lycopene. It's a good content, like antioxidant it is lycopene, which we get from tomatoes and watermelon. It can reduce also cancer risk, but nowadays if we consume watermelon, it can also increase the cancer risk because that adulteration is there. Then we can have antioxidants from berries and grapes. And actually one nice component is there, we call it resveratrol. So for anti-aging and for brain health it is good. Better you can pair it up with omega 3 as well. Then high calories, protein, and calories you can take it in two forms. You can take it as which is damaging your body as well as which is helping your body. So if you take calories from biscuits, pastries, fried foods, coconut oil is good. This can be dangerous for you, but they are calories as well. But increasing your calories with fish, meat, all those things can little more good. Then what we have is wellness session focusing on improving overall health and well-being. They include physical, mental, emotional, and lifestyle guidance. Physical is what we discussed, like nutrition, getting exercise, good sleep. Yeah, sleep is one important thing. What we tell is we should get around 7 hours of sleep, but the quality sleep, when we sleep by 12 and getting up 7 is also, we will get 7 hours of sleep, but it is not that healthy. The better time to sleep is around 10 to 5, 10 to 4:30, 10 to 5. This is the time where our brain really needs, like the physiology, it is like melatonin. When you off the lights, melatonin, a normal pigment is there, so that pigment comes, melatonin comes, and cortisol, the stress hormones, comes down. So when the melatonin comes up, it will be around 9:45, 10:15. That is the time when melatonin automatically sets in. So that time if you sleep, you will get a good quality sleep. And this is cortisol will be up by around 4:30, 4:35. So this is the time we will automatically get up. Once the normal rhythm, like we'll be sleeping with lights on, we'll be reading books, we'll be watching mobile, all those things, and we'll be thinking about the day. When you sleep, maintain a proper sleep hygiene. Don't think about anything. Next day, whatever it is we think, whatever happens, next day it is, once we get a fresh sleep and go to the next day, it will be fine. Otherwise, thinking that next day will also be gone. Then mental and emotional stress, you can speak with psychotherapist. Already our campus we have one psychotherapist as well, or else you can share it on a colleague you feel who is sensible. Then social relationship, support systems, spiritual purpose, values, meaning. Be spiritual. There will be one force which is pulling us forward all the time. Then initial assessment of lifestyle and health, goal setting tailored for the individual, educational and skill building, exercise, follow up and progress tracking. So the keynote is maintain your mental and emotional well-being, give more importance to your physical activity and overall cardio health and mobility training, encourage healthy weight and strong bones through all these diet. Always follow a balanced diet, hydration, and which prevents all chronic disease and which can boost your energy. So that is cut short of the.
Thank you, sir. Thank you so much for the session. It was very informative. I think we got an idea about screening examination for different cancers, also about hypertension, anemia, and most importantly, choice of food. As we know, prevention is better than cure. And also the small decisions we take every day, like ignoring our health, like fast food, bakery, Swiggy, Zomato, Instamart make it more easy and convenient. Especially as hostlers, we do miss our homely food, so we go for this fast food. So it is actually ignoring our health. And of course, there's a lot to be aware and to be careful of, because as sir said, restaurants and cafes compromise with the quality of food, but that doesn't mean we can compromise with our health. So thank you so much for the session. It was very informative. As women, we should be more careful about our health and hygiene. Thank you so much, and I hope nobody is having a doubt. And but I have a doubt, sir. How bad is taking and painkillers for period pain? Like Meftal 250, it is the often Meftal 250. Like, okay, okay. So I think nobody's having any doubts. Anything to ask? Okay. Okay. Thank you, everyone. Thank you, sir, for sparing your time. Thank you so much. It was really good. Thank you. So everyone can leave to your classes. Thank you, all the staff, everyone.